The deadliest year in American history is almost over. We're continuing to break coronavirus case records, and doctors think things could get even worse with us gathering together for holiday celebrations. As we look to what may be ahead for us in the fight against COVID, Rob Harris is letting the numbers and the data tell the story of how we got here.
This graph shows the year we went through in Indiana together. Here it is in Kentucky. Back when we were seeing daily case numbers like this, we didn't know that it would be a fraction of days like this. But we also didn't know that we would see an effective vaccine developed in record time and treatments improved to increase chances of recovery. It's all a matter of perspective. Indiana and Kentucky both had their first COVID cases on the same day, March 6th.
The question has never been if Indiana would get a case, but when we would see one.
To our Kentucky families out there that are nervous, this is what we've been preparing for, and we are ready. There is no need to panic.
As we learn more about the coronavirus, we learn more about how it spread through particles in the air. That's when scientists concluded that the best way to slow the virus from spreading was by wearing a mask. In July, both states decided that wearing a mask would be required in public places.
In the midst of a worldwide health pandemic, wearing a mask makes a lot of sense. And is it too much to ask? I don't think so.
Late fall and early winter saw spikes in the virus. The holidays came at the end of the year with COVID, so many of us feeling burnt out and isolated and understandably wanting to see our family in person again. But our leaders and health experts asked us to avoid travel in large groups because they worried that it could cause an already high case number to climb even higher.
You know what needs to be done. As hard as it is, you need to stay with only your own household all the way into the new year.
There are reasons to end the year hopeful. We have 2 coronavirus vaccines being distributed across the country, and health experts think we may get even more in 2021. Still, they worry our hardest days may be to come.
Our darkest days in the battle against COVID are ahead of us, not behind us.